Please use the Q&A button at the bottom of your screen to enter your questions. And please keep your questions brief and to the point, and we'll get through as many of them as we can. Questions will only be visible to MBOT staff and panelists. We'll review all questions that are asked, and we will do our best, as I say, to have your question answered. But we do have a number of attendees on this session today, so it may not be possible to get to them all. Now to introduce our guest speakers today. Dr. Lawrence Loh is the Medical Officer of Health at the Region of Peel, Public Health, and an adjunct professor at the Dalla Lana School of Public Health at the University of Toronto. He completed undergraduate training and medical school at the University of Western Ontario and his residency at the University of Toronto, during which he also earned a Master of Public Health at Johns Hopkins. He is board certified in family medicine in Canada and in public health and preventative medicine in both Canada and the United States, but we prefer to keep him right here in Peel. Ljubica Durlovska is an associate at Kaiser Mason Ball LLP and is a member of the firm's Employment and Labor Practice Group. Ljubica obtained her undergraduate degree from Western University in London, and it's just coincidence that we have a couple of Western grads with us today, in 2008, and her law degree from La Trobe University in Melbourne, Australia in 2011 with an honors distinction. Having worked with dentists for many years, Ljubica also holds a certificate in dental practice management from the University of Toronto, which she obtained in 2014. With a passion for employment and labor law, Ljubica has spent many years helping employers with a wide range of workplace issues, including assisting clients with employment contracts, discipline, investigations, policy development, accommodation, termination, and employment-related human rights and health and safety matters. Ljubica also has experience in corporate commercial law and leasing. Please join me in welcoming both Dr. Loh and Ljubica Durlovska. Dr. Loh, I'm pleased to hand the virtual podium over to you.
Trevor, thank you so much for that warm welcome, and it's a pleasure to be here with you and also to share the floor today with Ljubica. I'm going to present some slides here just around proof of vaccination and vaccines in the workplace. I just wanted to confirm: am I meant to share my own screen, or will this be shared?
You're to share, Dr. Loh.
Okay, perfect. Let me just bring that up then. Pardon me for a moment. Oops. Okay. So share. So and thank you everyone for the opportunity. So I'm going to just start my presentation here and talk a little bit about proof of vaccination and vaccines in the workplace, what you need to know. And I do want to thank first and foremost our collaborators here, the Mississauga Economic Development Office, Brampton Economic Development Office, the Town of Caledon's Economic Development Office, the Mississauga Board of Trade, and also the Brampton Board of Trade. Really grateful for the collaboration that has been able to bring all of us together to talk about a few things today. First of all, employee vaccination and where that fits in terms of workplace safety plans and risk assessment. And then, of course, proof of vaccination regulations, which have recently come into effect in respect of documentation, verification processes and exemptions, as well as enforcement. So launching into this in respect of keeping employees safe and employment policy, one of the things that is very clear in the province of Ontario is that there is a division between the mandate that we hold in public health and the mandates of employers under the Occupational Health and Safety Act. And it's a provincial requirement that employers are required to understand and follow the provisions of the Occupational Health and Safety Act. And during this pandemic time, there's two additional acts that actually apply. The Reopening Ontario Act, which specifies additional measures in respect of COVID-19 protocols across the province that are meant to keep workplaces safe during the pandemic. And then also here in Peel, a Section 22 class order for workplaces that specifies provisions around things such as notification of COVID cases that are detected, requirements to comply with the directions in respect of outbreak investigations and infection prevention and control, and of course, measures that may be taken in the event that that transmission is identified and needs to be brought under control. Where the difference exists between public health and occupational health and safety is that public health really gets involved where there is a broader risk to community health in workplaces. For example, if there's an extensive outbreak or if there's reports of an exposure, et cetera. But the preventive and proactive measures that need to be taken to keep and provide a safe workplace are specified under the Occupational Health and Safety Act as being the responsibilities of the employers. Ultimately, employers understand their business and know what is the best way to operate in a safe manner. And so I encourage you to refer to these regulations and to their guidance resources to understand your rights and responsibilities as an employer in the region of Peel and in Ontario. In respect of the Reopening of Ontario Act, there is a requirement for a workplace safety plan. This is a plan which basically outlines measures that will be used to protect employees as well as patrons and other individuals on site from COVID-19, which specifies specific measures such as screening, physical distancing, personal protective equipment, etc. However, given that we now have clear evidence with billions of doses delivered worldwide, 20 million doses delivered in Ontario alone, that the vaccines are safe and effective, it is Peel Public Health's strong recommendation that employers in the course of fulfilling their provincial mandate to provide a healthy and safe workplace should also consider in the course of their safety plans where vaccination fits. And specifically, the safety plans must consider how to promote vaccination to workers, how to outline any actions that may be taken to safeguard and protect unvaccinated workers or workers that have not had the chance to get vaccinated yet, and also plans to identify vaccination status for workers during the course of an outbreak to ensure that the provincial guidance in outbreak investigations can be applied appropriately and differentially to individuals based on their vaccination status to keep everybody safe. So in respect of employee vaccination policies, as I mentioned, the decision to actually implement an employee vaccination policy falls to employers. Again, you know your business best, and it is up to you to determine in the course of your work on a risk-benefit basis as the employer who is responsible for occupational health and safety, whether the use of vaccination, particularly how you are operating and the work that you are doing, might incorporate into your safety plan. And so this is our strong recommendation at Peel Public Health that employers assess the risk of COVID-19 exposure in your workplace, and then consider how to make workplace vaccination necessary based upon that risk. It is also important to note that this regulation and this the regulation for a safety plan and the recommendation from Peel Public Health applies regardless of how many workers on site are vaccinated, and does not prevent or obviate the need for additional measures to prevent COVID-19 transmission at this time. So certainly at this point in time, even if all of your workers are still vaccinated, it still is required under various statutes, including the Reopening of Ontario Act and our Section 22 order in the region of Peel, that additional measures to protect workers, such as masking indoors, reporting outbreaks and exposures to public health, cooperating with investigations and infection prevention and control directions, those all still apply regardless of how many workers in the workplace are vaccinated. If you actually determine that vaccination is to be a requirement in your workplace, it is Peel Public Health's recommendation that you seek legal advice to assist you in the development and the implementation and enforcement of any vaccination policies. It's important to ensure that any policy defines measures that employees must take in order to provide proof of vaccination. And you should also outline how the data that is collected will be protected under privacy legislation for the purposes of document collection. Now shifting gears away from employee vaccination mandates, as of September 22nd, we have now, the province has now implemented a proof of vaccination system that is required for anyone who is eligible for vaccination, 12 years or older, to enter certain businesses and public spaces. To determine whether your business is impacted by this proof of vaccination requirement, I encourage you to visit peelregion.ca/coronavirus/business for more information, to obtain guidance, and to also identify exemptions to the regulation of proof of vaccination. In order to appropriately address and implement proof of vaccination process, entry into a venue is permitted with the provision of both proof of vaccination as well as a piece of identification, which should match the name and the date of birth on the individual's vaccine receipt. October 22nd is the target launch when Ontario will apparently implement a phone app that will create a digital QR copy of vaccination receipts that can be downloaded. And it is really important to note as well that in addition to checking the name and date on the piece of ID and the vaccine receipt, it's vital to also ensure that the date of the vaccination is at least 14 days from the time that it was actually last provided. It's also important to note that if a patron chooses not to disclose their vaccination status at the time that this is verified, that the law does not permit access to areas that require this vaccination proof. There are opportunities for individuals to dispense with a proof of vaccination if they can prove that they have a valid medical exemption. The two medical exemptions that have been identified for people over the age of 12 by the College of Physicians and Surgeons of Ontario are anaphylaxis to a component of an mRNA vaccine as reviewed by an allergist, and also myocarditis or pericarditis to a previous dose of COVID-19 vaccine as reviewed by a specialist such as a cardiologist or an immunologist. People under 12 years of age are also exempt from the current proof of vaccination process. It is also important to note that when you are checking the receipt, you are not permitted to retain or store any information from the document. The purpose of the document is solely for verification at the time of entry. In respect of these new requirements with proof of vaccination, enforcement will be conducted by licensed provincial offence officers. This includes police, bylaw officers, as well as public health inspectors. Starting this month, the Ministry of Labour, together with local offence enforcement officers, will begin visits with an emphasis on education and localized compliance, and really ensuring that people understand their responsibilities under the new statute. Where considered appropriate, businesses may be able to seek assistance from their local municipalities. I believe, depending on the municipality, you'll reach out either to bylaw enforcement or to appeal police. I would encourage you to visit the relevant municipality. For Mississauga, at least for the purposes of today, it would be to their bylaw enforcement to determine additional information on being in compliance. So with that, I would like to thank you all for the opportunity to speak today. I want to also highlight, in closing, that the vaccines are safe and that they are effective. They have really made the difference in respect of the fourth wave that we are seeing here, with 80% of our community now covered with 2 doses. As we are able to continue promoting this vaccination process with 2 doses that are clearly helpful against severe disease and mortality. It is also vital that businesses in our region take the time to review your workplace safety plans and determine how vaccination may fit into that, while also complying with the proof of vaccination regulations that have emerged should your business be one of the identified businesses under that regulation. So thank you very much, and I'll pass it back to Trevor.
Thank you very much for that information, and we'll look forward to some Q&A after we hear from our next speaker. And so with that, I'd like to turn the microphone over to Ljubica Durlovska from Kaiser Mason Ball. Ljubica.
Thank you, Trevor, for the lovely intro, and to Dr. Lowe for the insight. I was having a little bit of technical difficulties earlier, but hopefully I've sorted that out and I can share my screen. Just give me one moment, please. My apologies, it looks like I cannot share my screen at this time, but that's okay. I think I'm going to go on the fly, and we'll do it without my presentation, but the presentation will be available on Monday, I believe it was said, and it will be up for you to review, and there'll be some resources there as well. So, as Dr. Lowe said,
sorry, Ljubica, I'm pretty sure we have it. I think Stephanie can pull it up.
Oh, that would be great.
You did send it to us earlier, so someone should be able to pull it up.
Okay.
Just bear with us for 1 minute.
Yeah,
I just sent it
I'm doing that right now as we speak.
Yeah, no, we definitely have it. So let's just hang on for. You spent so much time and effort putting it together. Let's get it up properly. Okay, here we go. Thanks.
All right. Perfect. Okay, so that's me. Next slide, please. Thank you. Okay, so as Dr. Lowe mentioned, there are a few ways that you might encounter vaccination policies in your workplace these days. The first is the recently introduced vaccination passports, which, as Dr. Lowe said, were introduced on the 22nd under the third step of the Reopening Ontario Act. And the second way, which is what I want to spend most of my time on, is through workplace policies regarding vaccination of workers and employees. Next slide, please. Okay. So here is a list. I'm not going to go through the entire list. It's a long laundry list of businesses that are required to comply with the vaccine passport legislation. Some include indoor and outdoor spaces of restaurants, bars, gyms, event spaces, casinos, etc. And because it's a long list, I've put up some resources at the end. And also, like I said, this presentation will be available after, where you can find this information. Next slide, please. Thank you. So patrons who are entering these designated spaces must provide a valid ID showing their full name and date of birth, plus proof of being fully vaccinated. It's important to note that staff have to check to make sure that the ID and the proof of vaccine have matching dates of birth and name. In order to be fully vaccinated, a patron has to have either a full series of vaccine authorized by Health Canada or any combination of those series, or 1 to 2 doses of a vaccine that's not authorized by Health Canada, followed by 1 dose of an mRNA vaccine that is authorized by Health Canada. And the third category is 3 doses of a vaccine that's not authorized by Health Canada. But regardless of which category a fully vaccinated patron falls into, they cannot be permitted to enter unless their final dose was received at least 14 days prior to entry. And I think Dr. Lowe mentioned this as well. So what the person who is checking passports is looking for is the valid ID, proof of full vaccination, as well as the last vaccination being on or 14 days prior to the entry. Next slide, please. Okay, so what constitutes proof of vaccination? It's defined very specifically in the legislation, and it has to be one of the following. The vaccine receipt or the certificate that's emailed or printed at the time of your vaccination, or the second acceptable document is one that can be obtained and printed through the Ministry of Health. And I have a link there. And thirdly, proof shown on the mobile app, which is coming later this month, but it's not yet in place. And it's said that the mobile app will have a QR code that may be scanned by businesses to access the vaccine certificate. As Dr. Lowe mentioned, and it's important to say again, that businesses are not permitted to keep these records on file. So once vaccination is checked, the records of vaccination have to be given back to the patron or destroyed. Next slide, please. So there are several categories of persons who are exempt from the requirement to show proof of being fully vaccinated. The first category are those who are entering not as patrons, but as workers, including employees, repair persons, delivery people, security guards, students, volunteers, inspectors, okay? I just want to point out that this first exemption of workers has many of our clients, at least, finding it very odd that that there is this mandate for patrons who come into the business to be vaccinated, and yet there is no equivalent legislation making vaccines mandatory for employees or persons who work within that workplace. So, but I'll get to that a little bit later. Other exemptions include those that are simply just passing through. So people who are coming through for reasons such as using the washroom, accessing an outdoor area that can't be accessed other than through the indoor area, to make a retail purchase, to purchase admission to an event, etc. Obviously, children under 12 who cannot be vaccinated can be permitted, but if there is a question about their age, they must show proof of ID. Those who are under 18 can enter a business for the purposes of practicing or participating in sports, but beware, because this class of person doesn't include being a spectator or watching a sport, and neither does it include the parents of a person who is participating in the sport. So if you are someone who maybe takes their kid to Taekwondo, as I sometimes have to, and you are not vaccinated yourself, your child might be permitted to enter without vaccination, but you yourself may have to stay outside and wait for them. So the last category that I have here is weddings and funerals. These are being treated a little bit differently. Specifically, those attending a wedding or a funeral ceremony at a religious or funerary facility like a church or a cemetery are exempt from having to show proof of vaccination. And between now and October 12th, the vaccination rules are being waived for persons who are attending a social gathering associated with that wedding or funeral, such as, for example, a reception that's being held in a convention center or meeting space, provided that they can show proof of a negative COVID test in the last 48 hours. Next slide, please. So the final exemption, and I'm not going to dwell on this because Dr. Lowe really made it very clear, is the medical exemption. And the medical exemption, the requirements are very strict. The document has to be written by a physician or a nurse practitioner. It has to be on their letterhead with their logo, and it has to include the name, the contact information of the physician or the nurse practitioner. And there has to be, pardon me, a statement that there's a medical reason for the individual's exemption, and Dr. Lowe talked about which reasons are permitted at the moment. And the final thing is an effective time period for the medical reason that includes the date that the person is seeking entry. Next slide, please. So Dr. Lowe touched on enforcement just briefly, but I want to talk about the dollars and cents of it all, right? Penalties can be very stiff for non-compliance with the vaccination passport legislation. For individuals, so patrons who are entering, it's up to $100,000 and 1 year in jail. For companies or businesses who have to enforce the legislation, the fine can be as much as $10 million. And the directors and officers behind that corporation can be fined up to $500,000 or a year in jail. Charges under the criminal code are possible depending on how out of the hand things get and if police have to get involved, if there are incidents, but that is on a case-by-case basis. Next slide, please. Okay, so now I'm going to switch gears and talk about vaccination policies in the workplace. Okay. And the vaccination policies in the workplace pertain specifically to that excluded class of persons within the vaccination passport legislation, which is workers. So next, oh no, we're at the right slide, pardon me. So are workplace vaccination policies mandatory? It's a great question, right? My short answer is yes, and here's why. Firstly, as mentioned by Dr. Lowe, the Occupational Health and Safety Act requires that all employers and managers take all reasonable steps to ensure workers' safety, and depending on the circumstances, that might include vaccination against COVID-19. So what's more, the regulations under the Reopening Ontario Act now require that businesses comply with advice, recommendations, and instructions issued by a medical officer of health. As you heard Dr. Lowe say, he strongly recommends that employers develop COVID-19 policies, and most, if not all, other medical officers of health across Ontario have done the same. So that recommendation, coupled with the legislation that says employers must follow recommendations, makes vaccination policies legally mandatory, right? I do want to briefly do a little sidebar here, and I want to talk about another document that is mandatory, but I don't have time to speak about it here, and that is the COVID-19 Workplace Safety Plan. I encounter a lot of my clients who don't know what that is or where to find it, but I will say you do need it, and there are resources that we will put up for you to find out how you can put one of these workplace safety plans in place for your business. Next slide, please. Okay, so I want to clarify something before I move on. And it's a matter of semantics, but it's a matter that needs to be set straight before we can move on, because I think there is a lot of confusion stemming from the misunderstanding. Mandatory workplace policies regarding COVID-19 vaccinations is not the same as a mandatory vaccination policy. The former can be instituted without making vaccination mandatory. Vaccination policies can range in their contents from simply recommending that workers get vaccinated to making vaccinations compulsory and a condition of continued employment, right? So there are workplaces, I will say there are workplaces that do have mandatory legislation that applies to them, and I'm not speaking about those workplaces in particular, places like hospitals, care homes, ambulances, as well as workplaces in a unionized environment where they're subject to a collective agreement. So we'll leave that for another time. Next slide, please. So as I said earlier, vaccination policies are not one size fits all. They can come in all shapes and sizes. And what will be the right fit for your business might not be the right fit for a different type of business. So for example, a business comprising solely of office workers, most of whom can do work remotely, will have a different health and safety requirement than a client-facing retail chain, for example, or a personal services business such as a massage parlor or a nail salon. So how do you decide? As I think Dr. Lowe mentioned, a workplace risk assessment is going to be integral to your decision about what type of policy is suited to your business. I think it's important to mention here that the Joint Health and Safety Committee or the health and safety rep of your company should be involved in all steps of the process. As an aside, businesses with 5 to 19 employees must have a health and safety rep who is part of the workforce and who is chosen by the workers to become the representative. And workers with 20 plus employees have to have a joint health and safety committee, also known as a JHSC, composed of both workers and management side employees. So the rep or the members of the JHSC are required to have health and safety training. And so they are going to be well equipped to take on a COVID-19 risk assessment for and with you. Importantly, because of the involvement of the workforce through the rep and the JHSC, your workplace policy will hopefully have more legitimacy and have a higher rate of compliance because of that involvement. Next slide, please. So the $1 million question is, what is involved in a risk assessment? First of all, the risk assessment should be done on each position or category of worker. Because, for example, a field agent who's required to travel internationally for their work will have a different amount of risk than, let's say, a software developer sitting in their office or their home hacking away at the keyboard, right? Consideration should be given to any proven heightened risk in the setting or job position. So what might be proven or a proven risk? Well, one example that I can think of and I've come across is COVID-19 outbreaks among college and university residences that were made public through the media. I would say that that is a proven risk. On the other hand, there are workplaces such as dental offices where you may think that there is a heightened risk given the proximity to patients, as well as any particles being generated during procedures. However, to my knowledge, there is no known outbreaks that have stemmed from a dental office. So in this case, it might be harder to mandate vaccination based on a proven risk. But the assessment doesn't stop there. It has to also take into account the physical space. So this includes the ability to erect barriers, whether there's enough space to socially distance, as well as the quality of the air and air ventilation. Consideration must also be had for the type of public interaction workers have. So for example, if the workers themselves are in a vulnerable category or they have to interact with vulnerable populations, or those who can't be vaccinated, such as children, that may mean an increased rate of transmission or increased risk for severe infection. There may be other industry-specific considerations you will need to include in your assessment, but this is just a starting point for you to work on a risk assessment. Next slide, please. So here's the legal test for any workplace policy, including COVID-19. There are 4 considerations. The first is it necessary? This will be answered by your risk assessment, of course. In other words, if you find that the risk to employees is minimal, then it wouldn't make much sense and it wouldn't be necessary for you to have a policy that mandates vaccination. Is it reasonable in the circumstances? For example, if your risk assessment is that your cleaning service team, for example, is at high risk of COVID-19 transmission because they have to enter into people's homes, would it be reasonable to ask that they obtain and put on hazmat suits when they enter homes and take them off when they exit? Now, the hazmat suit will achieve the goal of protection, but is it reasonable in the context of a cleaning person? Maybe, but maybe not, right? The third consideration, and the next part of the test, is the policy only as intrusive as it needs to be to achieve the goal? In other words, if masking, distancing, and sanitizing can achieve the same or similar level of employee safety as vaccination, then it is the least intrusive measure, right? So other alternative non-intrusive measures that can be taken to protect workers include additional personal protective equipment, which may or may not include hazmat suits, alternate or remote working conditions, screening, sanitizing, masking, and distancing. And last but not least, testing can be implemented as a less intrusive alternative, which is something we are seeing a lot of. The last part of the test, but arguably the most complicated, is does the policy discriminate based on a protected ground under the Human Rights Code? Next slide, please. So accommodations based on protected grounds is a topic that deserves its own 2-hour seminar, but we don't have the time to do that here. So I'm going to touch on the most important parts of the human rights accommodation process. Firstly, I want to draw your attention that although the vaccine passport legislation only allows for a medical-based exemption, workplace policies may need to accommodate employees for other grounds, such as religion or creed. And I emphasize the word may there because discrimination may be permissible in some circumstances, but I'll get to that in just 1 second. Next slide, please. So last week, the Ontario Human Rights Commission weighed in on the mandatory vaccination policies and essentially said that vaccination requirements for patronage as well as workplaces are generally permissible. They stress the importance that the measures last only as long as they're necessary and that appropriate safeguards must be in place to protect personal health information. The Commission also stated that COVID testing is permissible in organization with a proven need for COVID-related health and safety requirements, either as an alternative to mandatory vaccination or as an option for accommodating those who cannot obtain vaccination due to medical reasons. The most interesting part to me is the fact that they said that personal preferences and singular beliefs are not protected under the code. Specifically, and I want to read this to you because wording is very important. They said, receiving a COVID-19 vaccine is voluntary, full stop. At the same time, the OHRC's position is that a person who chooses not to be vaccinated based on personal preferences does not have the right to accommodation under the code. So that is important. Further, they say even if a person could show that they were denied a service or employment because of a creed-based belief against vaccinations, the duty to accommodate does not necessarily require that they be exempted from vaccine mandates, certification, or COVID testing requirements. The duty to accommodate can be limited if it would significantly compromise health and safety amounting to undue hardship, such as during a pandemic. So if it sounds to you like they're saying that a business or workplace can discriminate in the name of health and safety, then you are right. Next slide, please. So let me explain that. If there is a prima facie discrimination, but in the workplace through a policy, but the discrimination is reasonable and bona fide in the circumstances, then it might be permitted. This is called a bona fide occupational requirement, and we usually shorten that to B4. It's important to know that once discrimination is established, the onus then shifts to the employer to prove that the policy, discriminatory as it may be, is a bona fide part of the job that was A, adapted for a legitimate purpose, B, adapted in good faith to achieve that purpose, C, that it was reasonably necessary to accomplish the goal, and D, that the accommodation of the employee would cause undue hardship on the employer. So what is undue hardship is hard to pin down. Judges have been vague, to say the least, about what it is. We can glean it from case law, but we also know that there are specific things that it is and is not. So the more concrete things that we know about undue hardship is that only cost, outside sources of funding, and health and safety requirements can be taken into account when deciding what is undue hardship. We also know what we can't take into consideration when deciding on what is undue hardship on the company, and that is business inconvenience, employee morale, so the fact that other employees don't like your policy does not make a difference, and third-party preferences. And lately, I have been getting a lot of questions about third-party preferences where businesses are being asked by their clients whether or not they can interact with or have business only with vaccinated individuals. But this cannot be part of the test for undue hardship. Next slide, please. So the last part I want to, the last point I want to make about determining and verifying vaccination status. So assuming that vaccination in some way factors into your workplace policy, even if it's a vaccinate or test policy, you'll have to deal with privacy issues and how to verify vaccination. You have some options in that regard. You can take employees' word on it, which is just a self-attestation saying, I hereby declare I have been vaccinated. And I believe I read just today that the federal government will be accepting self-attestations in certain circumstances. Another way you can do this is to require the same documents as is now required for patrons under the vaccination passport legislation. Or, like some of our clients have done, you can hire a third party to verify vaccination. However, you have to be mindful that vaccination status is private health information. And unlike for patrons, businesses may wish to retain copies of employees' vaccination status. So the confidentiality and handling of that information is of utmost importance. Regarding disclosure of vaccination status, if you are farming out the vaccine verification process, or if you plan on informing clients that your staff are vaccinated, then you must obtain your employees' consent to do so. Failure to do so may result in a breach of the Personal Health Information Protection Act. Okay, and slide, please. There are just some of the resources that you can access to help you navigate the vaccination passport, as well as to come up with workplace policies that are suitable to your business. And that is me. Let me see, next slide, please. That's it for me. I hope I answered a lot of questions there.
Well, thank you very much to both Dr. Lowe and to Ljubica for excellent presentations. And yes, you did cover a lot of what I've seen coming in through the Q&A. We're gonna try and get through as many of these as we can. If they're not duplicative of, I think, what the presentations already gave us today. So I'm gonna do my very best to get through these questions, and obviously both to Dr. Lowe and to Ljubica, jump in when I ask the question if you think you're the best suited to answer it. By the way, I'm Brad Butt, the Vice President of Government Stakeholder Relations, Mississauga Board of Trade. I guess I didn't introduce myself earlier for those who don't know who I am. Let's start with a question that was sent in earlier. What legal authorities can a business rely on to implement a mandatory vaccine and testing policy in the workplace? I assume that would be Ljubica. You'll have to take yourself back off mute.
Apologies.
Yeah,
So,
I know. The word of the century. The phrase of the century.
So as I said in my presentation, there is the Occupational Health and Safety Act that requires employers and managers to take action on employee safety, and that includes against COVID-19. But then there is also the Reopening Ontario Act that requires employers to comply with the advice, recommendations, and instructions issued by medical officers of health. Dr. Lawrence Lowe will tell you he has made that recommendation, and so have other medical officers of health within Ontario. So when you combine the two, the legislation plus the recommendation, that makes vaccination policies mandatory in Ontario.
Did you want to jump in that, Dr. Lowe, or are you good with that? You're good with that. Okay, moving on. Could an employer become responsible should an employee suffer a serious adverse reaction to the vaccine that they took in response to a mandatory vaccination policy?
So that's a really good question, because currently there is legislation that that states that other bodies like the government do not have liability for COVID-19. However, employers, non-unionized workplaces were specifically excluded from that legislation. So I think that the question goes both ways, is that you can be liable if a person suffers an adverse reaction while complying with your policy, but you can also suffer liability if an employee contracts COVID-19 in the workplace and you don't have that policy. So it's a difficult and blurry line, I would say, and that's kind of where I'm going to leave it.
Okay, thank you. The next one is for Dr. Lowe. Dr. Lowe, booster shots. Do you want, I know you mentioned those in your 2 press conferences this week with our mayors. Do you want to talk about that issue about the booster shots, particularly for population 60 plus, but I guess just generally, are we getting there? Are we going there, or where are we on the booster shot issue?
Thanks, Brad. At this time, there is no recommendation for third doses for the general population. Third doses have been approved by federal government and also directed by the Ministry of Health for individuals who have challenges mounting a more robust immune response. This includes seniors living in congregate settings, such as long-term care and high-risk retirement homes, as well as individuals who have immunocompromise, either due to cancer or other immunological conditions. In the region of Peel at this time, we are not giving third doses to the general public. Third dose referrals are being made by practitioners within the community at both our hospitals as well as practicing elsewhere in Peel. It is my impression, however, that we will continue to monitor the data. The situation in Canada is materially different from other countries, which stuck very closely to the original 21-day manufacturer interval. We extended intervals up to 8 to 12 weeks, and data both here in Canada as well as internationally now suggests that that was the correct move to actually ensure that the prime and boost were appropriately spaced between the 2 doses.
Okay, thank you very much for that. Next question was raised earlier, or I think, Ljubica, you talked about a little bit. Contractors, others that are coming to workplaces, and these rules around vaccination, not vaccinated, whatever. Can you clarify some of that again from the best of what you know? If I think someone's actually said, if the repairman comes to my place. Can you just clarify that a little bit more as to what the rules are, what the rules are to be around that?
Okay, so the starting point is that they are not required to show proof of vaccination if they're entering a workplace. So under the vaccination passport legislation, they're not required to show proof. So even if it's at a bar, a restaurant, if they're there to repair, if they're there as security, if they're there as visitors, volunteers, etc., they are not required legally to be vaccinated. Okay, that's the starting point. However, employers may wish to implement policies that do require them to be vaccinated because employers have to take health and safety of their workers, their workforce, and those who visit seriously, right? And like we talked about before, there might be liability either way. So although legally not mandatory, a workplace vaccination policy may wish to cover those people in particular for vaccination. And it might be mandatory vaccination to enter, and it might be a test within the week, within 48 hours, whatever is decided within that policy based on a risk assessment.
Okay, I'm going to try and sneak 2 more questions in because I know we're running out of time, and hopefully one for the lawyer and one for the doctor. So the one for the doctor, I guess, to some degree, is the age group of 12, like to 18, whatever, going into places. They may not have photo ID. They may have been double vaccinated, but they haven't got anything to corroborate. Is there anything there that the government's worked on or public health officials have worked on to allow someone who's 12 plus that may not have any ID at all to show to a place of business? They're going to a restaurant, they're going to a Sky Zone. I was there last week with somebody. I mean, the kids want to jump on a trampoline, but they have to show their proof of vaccination, but they wouldn't have photo ID to back it up. How is that going to be dealt with?
So Ljubica can probably actually confirm this, but my understanding is that it doesn't have to be photo ID. It just has to have the individual's name and date of birth.
That's correct. And I think for individuals who don't have that information, there is a hotline that you can call to obtain the information. So if you are a person who doesn't have an address, if you're a person who doesn't have ID, there is that hotline there available for you to access and get the proper certification to enter these workplaces.
Okay, and I think maybe we can get two more in. The next question we have is really around workers that are just not being cooperative with their employer over either asking, the employer saying you have to show me ID or proof of vaccination, etc. And what happens if they don't? Can you, send them home without pay? What are severance issues involved if it's that blatant that you decide you need to dismiss the employee? What are the employer's obligations around that? I think we saw a flip in view by the TTC union this week on that issue. They did a 180. Other groups may do that. I don't know. I'm just using as an example I saw on the news, but we've got this conflict now about, and not just unionized workplaces, obviously non-unionized as well. So can you give some guidance again around what, to the best of your knowledge, what you think?
You can't leave me with 5 minutes on a topic that I can spend 2 hours on.
I know.
So it's really a very difficult question to answer, and it's really case specific. But I will say this, is that employers have a duty to respect the process of accommodation. So if someone comes to you and says, I have an accommodation, or I need a medical accommodation, or I need religious accommodation, the employer has a duty to respect the process, right? And they have to do everything in their power to help the employee. It's a cooperative process that they have to assist the employee has to assist them to figure out A, whether the accommodation is necessary, and B, if the accommodation is necessary, then what can be done to accommodate the employee while they're working. So workplaces have chosen to do a vaccinate or test policy, which is seen as sort of an accommodation. As we saw, the commission, the Human Rights Commission, has now said that yes, testing can be an important part of the accommodation process because it is the less intrusive way to get people to that point of safety. Right. But in terms of what disciplinary actions an employer can take, that really varies based on the policy itself and the situation in which you're in. So I can't, given the time constraints I have here, I don't think that we can get into all of those. But that's what I'll say about that.
Okay, well, thank you for that. And last question for Dr. Lowe that's coming up again is, what are the current requirements and measures for people working in indoor spaces around masking and other, public health measures that are still required, either legislated or just good business practice? You just want to give us another a minute or so on what are the legal requirements? Because we know there's face covering bylaws that our municipalities have passed and are still in force and effect. And there's other guidelines that are there that Peel Public Health and others have put out. So Dr. Lowe, why don't you finish with that? As far as, I think we're talking more indoor congregate settings of businesses and other places. So do you want to just give us an update on where that is right now, how long those measures are going to last, so business people know how to operate their workplaces appropriately?
Also, Brad, similar to Ljubica, I think the last webinar I gave a whole 30 minutes on that. So unfortunately, it's not something I'll be able to go into depth. What I can tell people is peelregion.ca/coronavirus/business has manuals and guidelines that are available. In broad strokes, it really is a multi-layer approach to workplace safety as it pertains to COVID, starting with ensuring that individuals who are sick or could have been exposed are not introduced into the workplace through ensuring sick leave, ensuring people stay home, screening, and then when on the site, ensuring that depending on the nature of work, there are physical controls such as barriers, plexiglass, etc., masking, distancing, actual measures to limit crowding rather, in terms of things like cohorting or spacing. So there's a whole list, depending on the industries that are there. peelregion.ca/coronavirus/business outlines those, and also links to the Ministry of Labor's website, which has industry-specific guidance on workplace safety policies. It's an opportunity for me to remind everyone, though, that even with vaccination and even with the vaccination policy, and regardless of how many employees you have vaccinated, regulations still apply and transmission is still occurring in our community, and the vaccines are not 100%, which is why the additional measures for the time being still continue to be important. Now, a lot of these measures, together with broader community measures, will likely be able to be dropped at the point where this disease becomes endemic and no longer a severe threat to our healthcare system or to our lives. And we are getting close. Certainly the way this becomes less novel to our population is everyone has either been exposed through vaccination or through infection, and at a specific threshold very close to where the vast majority of people have been exposed through one of those mechanisms, the disease will cease to be novel and we'll be able to return to some semblance of normalcy.
Okay, thank you very much for that. I know a few people have asked about how they can get copies of the slide presentations. We will make sure those are posted in the appropriate format on our website in the next few days. And I'll just pass it back to Trevor for closing comments.
Thank you very much, Brad. And thanks once again to Dr. Lawrence Loh and Ljubica Durlovska for sharing your time, which I know is very tight these days, and your expertise with our audience today. As we continue to operate our businesses in the COVID era, we hope that today's event provided some guidance and support for you. The measures we're taking now are helping us to avoid a more impactful result, which is another lockdown, which, as I mentioned off the top, something that our businesses just can't take. And I think that members of our audience would agree on that point. So please, as we're kind of working through this as a society, encourage the people in your own networks to be kind out there. And MBOT truly appreciates the opportunity to present these webinars with our partners in Mississauga, Brampton, Caledon, and Peel Region. I'll now turn it over quickly to our events manager, Stephanie Giorgio, to take us home and tell you about some upcoming MBOT events. Stephanie.
Thank you, Trevor, and good afternoon, everyone. So join us for a few upcoming events. So on October 5th, we have a WLC featuring Dr. Janet Morrison, President and Vice Chancellor of Sheridan College. October 13th, we have our Good Morning Mississauga, which is our monthly networking event. On October 20th, we have an MBOT webinar, The Way Forward, New Growth Opportunities for Business Owners. And on the 21st, we have MBOT webinar, Returning Employees Back to Work and Workplace Mental Health. And on the 27th, we have the From the Corner office with our very own Trevor McPherson on his first 90 days as CEO and President of Mississauga Board of Trade. Thank you, everyone. Enjoy your afternoon. Thank you, Dr. Loh, and thank you for Kaiser Mason Bell for joining us today. Take care.
Thanks, everyone.